Magnesium is the subject. Magnesium related to restless leg syndrome at night, muscle cramps in general, pain, and heart arrhythmias. So talking about restless legs, we've done a show on this in the past, but I wanted to come around and visit this again because of all the great improvements that I've seen with magnesium recently. 4 things you need to know. The form of magnesium counts. Number 2, we're going to talk about eliminating calcium. Number 3 is water. Number 4 is chiropractic care. So regarding the form of magnesium, oftentimes if you talk with your doctor, they will prescribe magnesium oxide. There are many different forms of magnesium. Magnesium oxide might be prescribed. My suggestion is don't bother. There are some magnesium oxide that you can buy in the store, and stay away from that. Here's one patient story. A patient of mine in his 40s, I've been doing the chiropractic magic thing on him. He had been struggling for back pain for many, many years, gone to different doctors and therapists and so forth. He ends up in my office. We're doing a really great job with his lower back. He is super excited. Best he's been in decades. Then he talks to me about his restless legs. He says, my restless legs are so bad, I am punting my wife out of bed almost every night, and literally she has to go and sleep on the couch. This is what he told me. I said, no problem. Magnesium for you. I said, it's probably going to work very quickly. Sure enough, one night of magnesium, the magnesium I have in my office, which I've talked about here before, he took it. He says, my legs didn't move. My wife stayed in bed. You saved my marriage on 1 cent worth of magnesium. So he's continued taking his magnesium, and he's doing great. He ran out. He didn't take it for 3 or 4 nights, and his legs started kicking again, and his wife was out of the bed. He came back in my office, got the magnesium. Again, 1 night back on the magnesium, legs are fine. So then he suggests it to his sister. His sister starts to take magnesium, not working. She had a very similar thing, restless legs. So he talked to me about it because I happened to ask after a few weeks. I said, hey, how's your sister doing with the restless leg? He said, didn't work. I said, tell her to take a picture of it and send it to you and show it to me. Sure enough, she picked up magnesium oxide in the store, showed it to me, magnesium oxide. I said, won't work. She needs magnesium glycinate, chelate, malate, one of the other, citrate. Try one of the other magnesium, see what happens. She got another form of magnesium, and it worked. So there was confirmation once again that the oxide is not working and the other forms are definitely working. So keep that in mind. Number 2 is stop calcium. I'll talk about a couple of cases here in just a moment. Calcium is an excitatory mineral. It turns things on. It makes muscles contract. It makes nerves fire. When you're going to bed, do you want your nerves firing and your muscles contracting? No. People are taking way too much calcium as a supplement, in my opinion, and Dr. Carolyn Dean agrees with me on this. I've done this with a few women now. I've taken the calcium away, particularly women in their 50s and 60s who are taking calcium. One of them just said this week, they said, and it's being jammed down our throats, postmenopausal women need this calcium to protect that bone. It's just not working. The calcium is not being absorbed. We all have the concept that when we're taking a calcium supplement in, when we digest it, it's going right into the bones and making our bones strong. It's just not happening. That extra calcium floating around the system is cranking up, blood vessels are constricting. Calcification of arteries, Somebody ought to look into that. With heart, we tend to take calcium channel blockers. Well, that sounds like an issue, doesn't it? How about removing some of the calcium so we don't have to take those blockers? Maybe. And then it's keeping those nerves firing and the muscles contracting, okay? So we're taking the calcium away from some of these folks and then giving them magnesium. The legs are settling down, the cramps are going away during the day as well, and now we're finding pain is getting better. I just had another woman in her 50s come in at the end of last week. We got her restarted on magnesium, and she said her neck and upper back that was really cranky over the past several months is now gone. So that's another thing, because magnesium is a calming mineral. It can take those pain systems and knock them down. Water, if we're dehydrated, things just don't work right. Remember, go back to my other videos that I've done. Water should be half your body weight in ounces per day as a rough gauge. Back to calcium for just a moment. If you've been prescribed calcium by your doctor, don't just stop calcium from what I just said. Go talk to your doctor about these things and maybe you can make adjustments. And then lastly, I find a lot of people, if they're having trouble, they're doing the magnesium thing, they've eliminated calcium, they're doing the water thing, but they're still having trouble at night, I make sure you're getting evaluated by a chiropractor, because it could be your nerves coming out of your lower back are having issues. And I find that a lot of my patients are doing spine stretches in the morning, but they're not doing them at night. So doing their spine stretches at night, particularly for their lower back, can settle down the lower back and all of that information that's coming into the nervous system. And that can settle down the nerves that are going into the legs, causing the jumping muscles, okay? So let me pop through a bunch of results that we've had in 2018. These are just some patients that I've taken some notes on. A woman in her 60s, this is one of the women who we decided to stop the calcium and add magnesium. She says, restless legs are doing great, my muscle cramps are awesome. The 40-year-old man we talked about, we saved his marriage. He came back and said, Dr. Fuller, you saved my marriage. A woman in her 50s, back in February of 2018, we stopped calcium and started magnesium. She said it's really helping the muscle tension at night, and she's sleeping better, and she also has less neck pain. My mother, when she was alive, back in her 70s, she took magnesium. This has got to be 15 years ago now, and it really settled down her legs at night. A 32-year-old man, when he had a pericarditis issue, it has come up a couple times in his life, he started magnesium. He said it definitely is helping his issue with his heart. A woman in her 70s taking magnesium, she's getting great results, less restless legs. A woman in her 40s just recently restarted her magnesium, and her neck pain that she was struggling with for months and months is now almost gone. A woman in her 30s said magnesium is reducing her cramps, and she's sleeping better. A man in his 40s, in one night with terrible restless legs, he said, it's gone, I am so happy, and he just stays on his magnesium every day. A woman in her 50s, new to me, she started magnesium. She said, I started taking it before bed. I waited and waited for my legs to start flying around, and nothing happening, no flying legs or jerking legs. Thank you. She wrote me an email the next morning because she was so impressed. Here's a woman in her 60s. She started magnesium for a heart issue. She said the magnesium is working very nicely. She had a heart monitor on herself for 6 days. She can definitely tell her heart is improving each day with magnesium. A woman in her 60s, magnesium is helping her. A woman in her 80s said it's helping her sleep. A man in his 40s said it's helping me get to sleep, and he's sleeping more soundly being on magnesium. A woman in her 30s said she started taking it because she was not staying asleep, and it's definitely helping. A woman in her 90s started taking magnesium, and her bowel movements are better. And some of you may know that magnesium, if you take too much, it can cause loose stools. So just be aware of that. Don't necessarily jump up taking too much. Maybe you start with a couple of 100 milligrams, and then you can titrate up if needed. This woman said, oh my gosh, this magnesium is wonderful. My bowels are working better. A woman in her 60s said magnesium is helping with her muscle cramps. A woman in her 20s has said it's helping me to get to sleep and stay asleep, and it's helping me relax. A woman in her 40s says she's sleeping better on magnesium. Another woman in her 70s said, my restless legs is gone, muscle cramps are better. She's sleeping better, which now means she has more energy during the day. And a woman in her 70s said she started magnesium in January. By February, she noticed less joint aches, and she noticed less muscle tension. That is some of the magic that you can occur with just adding magnesium into your life. And if you want really detailed information on a lot of different things, go to Dr. Carolyn Dean website. Just before I came in to do this show, I got this quote from Dr. Carolyn Dean. Too much calcium is pushing out your magnesium. Read Why I Hate Calcium. She has a blog post that stated why I hate calcium, to understand why the most prescribed mineral is actually dangerous because it's causing heart disease in women. I'm Dr. Scott Fuller. Join me again.